Welcome, everybody. And for today's interview, I am very fortunate to have Dr. Douglas Weiss. He's a psychologist and the founder of Heart to Heart Counseling Center, which specializes in the treatment of sexual addicts, intimacy anorexics, and their spouses. He has counseled with sex addicts and their partners for almost 3 decades. Heart to Heart Counseling Center maintains weekly 3- and 5-day intensives that couples from all around the world attend. Dozens of weekly groups, hundreds of weekly appointments with 16 counselors on staff. Dr. Weiss personally continues to provide 5-day intensives at his center. Dr. Weiss has been in recovery for over 33 years. And him and all of his counselors at Heart to Heart verify their sobriety with regular pilographs. Dr. Weiss has authored more than 40 books and offers 30 therapeutic DVDs for men, women, and marriages. He is proud to be the first author to write a book for partners of sex addicts. Dr. Weiss was the first to coin the term intimacy anorexia, which is the withholding of emotional, physical, and spiritual intimacy in marriage. He's been an expert guest on numerous national shows, including Oprah, Dr. Phil, Good Morning America. He had 2 documentaries, Lifetime TV Network, and a British documentary produced about his practice. He's also the president of the American Association for Sex Addiction Therapy, which is a certification training program for sex addiction, partners of sex addicts, and intimacy anorexia. Dr. Weiss is a dynamic international speaker at men's, women's, and couples conferences. So I am very fortunate and glad to have you with us, Dr. Weiss.
Good to be here, right?
Yeah. And I got to see your practice in person in Colorado. I was really impressed. Great location too. Absolutely beautiful area, and your location's beautiful itself. So I can see why you get clients from all around the world. And I got to take a look at your book, Intimacy Anorexia, which I was also really impressed by. I liked it a lot. I've actually shared with several people already the insights that I got from that book. So I really appreciate your work. Yeah, the work that you do is very important. And we specialize in telehealth, providing behavioral health through virtual means like video conferencing and phone. And I know that people that struggle with issues that can induce shame, unfortunately, often seek counseling in ways where they feel more safe, say through phone counseling, video conferencing. And I know that your practice does that a lot. So if you could share a little bit about what your practice provides and what the telehealth aspect is in terms of the services that you guys provide.
Sure. Well, first of all, thank you for coming out and doing a training for my staff. It was very helpful. Everyone from the interns to seasoned counselors benefited from it. It was real. It was educational, informative, and it was done in a really good style. Appreciate that. I've been doing telephone counseling for over 30 years. I'm actually one of the first people in the country to do telephone counseling because of exactly what you mentioned. I would do an Oprah or a TV show or something like that, many of them. And this was before cell phones. Okay, so you have to kind of imagine a world without cell phones. You can do that for a moment. And so people would call in and say, there's no one in our area to help. And we're like, okay, we just have to fix that. So just call in, we'll do an appointment. We were doing appointments, this is back in 1990, okay, and do a telephone counseling and helping people all across the United States, all across the world, because they would see stuff. And then the internet came, and again, we were the first one out there. Sexaddict.com was the first website on sex addiction in the world. And so we got tons of calls from all over the globe. And so it's been a mainstay in our practice. We have people who that's the best way they can do it because ethically there is no one in their area. There just isn't.
Right.
There isn't someone who understands sex addiction. There's not anyone who has a group for it. There's no one who can support them. There's no one who can walk them through the steps. And so ethically we felt responsible to provide something for those people who can't either find treatment or find treatment that helps them.
Yeah, just in terms of that specialty and not having clinicians in the area, it seems like for the clients themselves, if they're, it takes a lot for someone to get to the point to like seek that kind of help. And then if they go and seek that kind of help from a local clinician who truly doesn't really know what they're doing, but they'll try, that I suppose that might actually be damaging because
it can be very damaging. I've cleaned up thousands of messes because here's what happens. Like I'm the president of the American Association for Sex Addiction Therapy. And so periodically we will go and we'll pick a city, Chicago, maybe Montgomery, Alabama, Miami, and we will Google sex addiction, help, treatment, right? And we will literally go through the top maybe 8 to 10, 15 pages of Google, which is about 100 to 120 different clinicians. Of all of those that say they treat sex addiction, 90 to 95% have no training. None.
Wow.
There's no certification, and they might have read a book somewhere, maybe, kind of, but they just click the little boxes, you know, on the thing, and they just click every box they can. And sure, if you want to come in with sex addiction, hey, you can talk to me, right? But they don't have a clue what they're really doing.
Right.
And so that's actually one of the reasons we started the association, because there's so many therapists promoting themselves as someone who can help. But when you actually get into it, they don't know the 6 types of sex acts. They don't understand intimacy and anorexia. They don't understand partner betrayal trauma. They don't understand the dynamics of the marriage that goes on with someone who's been betrayed, how to reestablish trust. And if you even ask them those basic questions, they don't have a clue. And so again, ethically, there has to be a place where someone can at least start with dealing with intimacy and anorexia. Because if you haven't had sex in 10 years, that's hard to, you know, face the therapist you're going to see at the grocery store, you know. So we created this bridge for them to be able to have a place to open their heart, talk about the, you know, the pornography, the affairs, or the lack of sex, or the lack of connection, or just the trauma and the grief of marrying somebody and finding out that they're not that person.
That's a great example that you gave. You share with your therapist, hey, my wife and I haven't had sex in 10 years, right? And then you see that therapist at the grocery store out and about in town. I could definitely see through that example, like how people would be really hesitant, you know, to seek counseling locally in their own area.
Especially if it's a small town. If you're under, say, 30,000, you're going to run into your therapist at a restaurant, the library, or somewhere. And there are some topics where that's okay. You got anxiety, you get maybe a little depression, and you run into your therapist. It's like, oh, quick hug, you know, it's great. But you see the guy who you just told that you had, you know, sex with 20 prostitutes. You don't even want to say hi to him. Like, you don't want to be associated with, like, well, if someone sees me and say hi to him, they're going to think I have a problem. I remember one time a pastor of a mega church here in town, and he was my personal pastor. He's like, you know, Doug, I wanted to stop by your office, but I didn't want anyone thinking that I had a problem.
Oh my gosh.
So
so you guys got started with the phone counseling out of a need. I mean, there was a very clear need had to be filled, so provided through phone counseling. But it sounds like not only was it just to fill a need, it sounds like it also meets clients where they need and what they need in order to receive effective therapy, because they're going to be much more willing to, say, open up with their clinician. Is that the case?
Yeah, and because we have a brand or reputation of really knowing what we're doing.
Okay.
They would, you know, I would rather see, if I had a problem, I'd rather go to someone who's really good at my problem.
Right.
And I'd rather spend a half hour with them than 16 hours with someone who's kind of just guessing.
Right.
You know, on 50 different tests to find out what this guy can tell me in 5 minutes.
Sure.
And so because of that reputation, people also seek us out because of excellence, not just because of the local situation. But, you know, we have an assessment style that really in 15, 20 minutes, we can tell you what type of sex act you are, what you're going to need to do. If you are intimacy and anorexia, if you do have trauma from the betrayal, like, okay, we know what you have now, and now we know what to do with you. Right. You know, where you go to a general practitioner, you could spend 3 sessions and they don't even find out that you've been sexually abused and how that plays into your addiction. I find out in the first few minutes.
Right. Yeah.
So
and also, I would imagine clients know that you're going to be understanding. You're going to understand their situation to a good extent. which means there'd be less fear of maybe the stigma.
Sure.
Talking to someone that hasn't, because people that work for you and yourself, you've spoken to many people, all sorts of sex addiction situations. So they know this, this professional, this expert is going to have a good understanding. They're not going to be shocked by what I say. Yeah. So yeah, definitely a need. Now, in terms of, providing services when someone's sitting in your office versus on the phone, are there any differences that you could identify and how you might do things differently?
Not at all, because we really, our approach is very principle based. Okay, so it's not, I don't need to see your body language to go run through your accountability checklist and see if you're doing what you're supposed to be doing in recovery. Do you know what I'm saying? I don't need to know what color shirt you're wearing. I just need to know, are you making your phone calls? Did you go to group? Are you working your workbooks? So I don't need to have, your facial expression to understand the principles. You're either doing the work or you're not doing the work.
Right.
And actually, because of that, if you're doing a phone session, it's actually easier because you don't get thrown off by that stuff either. I'm doing great. I'm doing great.
Don't get thrown off by what stuff? By the visuals?
By some of the visuals, because addicts are very manipulative. As a population, right? They come in and they're all slap happy. Hey, Doug, how's it going? Feeling great. Everything's going really well. Okay, how many phone calls did you make this week? Well, I didn't get to do any of that. Well, did you go? I couldn't do. Oh, so you're all this happy guy.
Give me the facts, right? Give me the facts. Let's work with the facts, not the BS that you're going to put up.
Right. So it kind of is actually helpful to maintain a principle-based practice, because it's kind of like, okay, are you doing the work? 1, 2, 3, 4, 5. Okay, why not? Let's get to it. Did you establish a consequence for that, or you letting yourself get away with that? So because we're principle-based in the way that we approach the whole thing, I think it's easier. I think there might be some populations, like if you're dealing with depression, that probably better to be seen in an office, and stuff like that. But if we're dealing with,
Now what about couples? Now I've read there was a research study that showed that couples are less volatile when they're communicating virtually than when they're sitting across from each other or in the same room. What's it like for you to provide counseling over the phone to a couple?
Well, again, it's no different. Because we do a couples assessment, we look at their structures, we look at dating, social, spiritual, sexual, financial, and emotional, and there's certain structures depending on where their weaknesses are they're supposed to be doing for homework. So we're checking in on that first, and we're not going down every rabbit hole, because if the structure's not sound, you can't have a successful marriage. Right? And so we get there first, and then if there the issues we can deal with, but I don't see any difference I've been doing it so long. For me, one session's on the phone, one session's in the office. Like for me, it's just going back and forth. And there's no difference, especially because in my case, the couples I'm counseling, I've already spent 5 days with.
Okay. Yeah.
So I really know them.
Yeah.
And when I hear that pause, like, because I have a picture of them because they were here for 5 days, and I go, oh, okay, I know who this is. I know what we're doing. Okay.
Right. So, yeah. So, I could imagine, with couples and working with any system or group, the nonverbals say a lot. So when one person's speaking, the other person's verbalizing silently, I guess you could say. They're reacting silently, which makes them more reactive, because when they're talking, they see their partner giving that smirk or whatever, right? Over the phone, they're not going to see that, and maybe they might feel like they're not being triggered as much.
Yeah, exactly.
But then again, you don't see that as the therapist, maybe the smirk on their face when their partner's speaking over the phone. Is there a way that you accommodate for that, the lack of verbal?
I don't think we miss anything by someone having a facial expression. They probably actually feel a little more free if he's in the truck and she's in the house, to really kind of do whatever they want with their face, because they're not being monitored, so they might even be more relaxed to be themselves. But they can argue over the phone and they can disagree. You know, sometimes people will hang up, I mean, very rarely, but sometimes they're like, you know, I'm out of here. I'm done with this. Okay. But the same thing in your office. They could walk out of your office and go, I'm not tolerating this anymore, you know? And so, again, I don't see a difference, and the results don't show any difference in the way we do it. With the intimacy anorexia, with that, it's the same thing. You know, people are following a known process that gives known results. And if you're working the work, you get better. It's just like, you know, losing weight or something like that. If your coach is over the phone, or if your coach happens to be at the gym, it doesn't matter if you're being accountable.
Right. Yeah. And, you know, I would imagine sometimes couples have a hard time going in to see a counselor because of scheduling, because of time, where they're, so I imagine you have couples where they're at separate locations.
Oh yeah, different parts of the country sometimes, but also there is a convenient issue, because if you live an hour away from town, which is very common to live an hour outside of town. So if you live an hour plus out of town, you're talking an hour there, an hour counseling, and then and probably something to eat. And so you're talking about 3.5, 4 hours out of your day. And so it actually reduces the motivation for people to do counseling. Mm-hmm. If they just have to close their door and they can deal with the intimacy anorexia, the sex addiction, or the betrayal trauma, whatever it is, go in there, do it. And maybe they spend extra 10 minutes thinking while they're in their room. Uh-huh. It's better that for them to sit there and process what has happened in the session, what insights they've got, or what they need to do for themselves while they're not driving. Yeah, right. You know what I mean? Because sometimes, you know, you're a counselor, and sometimes you have these really aha moments. And you just want to say to your client, you know what, why don't you stay here for another half hour and just sit with that? Right. Okay, well, they can't do that in and out of the office. Right. Next, you know, and they might sit in the cars. They're sitting, because if they go to your lobby, they're sitting around strangers. Right. It's not their space to really kind of integrate what they just went through with you, or to kind of chew on it, or, you know. Right. I have a lot of clients who do the phone stuff either as follow-up or even as their primary therapeutic relationship. They do that, especially women. They'll say, okay, thank you, and they'll spend a half hour in their room writing stuff down, thinking through it, wondering if they agree with what was said, and then, you know, give you feedback as to whether you're wonderful or not next week. But they'll actually sit down and think about it. Well, that's, to me, that extra 15, 20 minutes of being able to do that is incredibly therapeutic, rather than getting in your car and getting stuck in traffic and getting angry at someone and forgetting what you learned in therapy. Right. So you initiate that a bit. You invite them to do that at the end of the session. I want you to go think about this. Right. Yeah. Yeah. You know, also, there's a study that shows that people that receive phone counseling stay with counseling longer. And I went to a training on substance abuse treatment, and they said out of all the different modalities used, right, CBT, behavioral therapy, right, reality therapy, motivational interviewing, all those, the one that works best is the one where the client sticks with it the longest. Mm-hmm. So do you experience that with the phone counseling that you offer, that if it wasn't for the phone counseling, they wouldn't be continuing and not getting the information or the healing? Absolutely. That they need? You know, I have one client, I was just kidding with them the other day. They've been, this is not only have one like this, but they've been in counseling for over about 12 years. Okay. Okay. Yeah. Mm-hmm. And so that's very rare for me personally, but just also, how many counselors do you know who move? Right. Yeah. Right? A lot. So there's not just the issue of the relationship between the client and the therapist, but then the therapist, their kids go to college, or they want to go retire, or they want to go live somewhere else, or something. Well, then all those relationships are lost. The therapeutic relationship is lost. Whereas in our situation, you know, I could be anywhere, you know, and we can maintain that relationship. Or how about when the client moves? Well, with the teleconference therapy, it doesn't matter who moves. Yeah, right. You know what I'm saying? Because the relationship can stay in place. So that might be why. That might be something that would be a variable. Because well, and then those that come for your intensives, right? I would imagine that they would miss out on a lot if they came to your intensive, went back home, and that was it. Oh no, totally. We would lose a lot of success because they can go into groups, they can have follow up with one of the other counselors here. It's a great opportunity for them to stay in the sauce that's actually getting them better.
Uh-huh.
Because, because we do intensives, sometimes they're doing therapy before, sometimes we're doing therapy post. If the other therapist on the other end's been trained by us, it's going to work out just wonderfully. But if they go to a different model and start blaming the wife for why he's sleeping around, you can see how that's not going to work.
Right.
And then they got to shop around and do that. So the continuity of care is an ethical issue.
Yeah. So, you got me thinking that, because I was going to ask you, and I am asking you, what recommendations do you have for counselors who want to refer clients for sex addiction treatment? And one of the things that came to my mind talking about this with you is, hey, looking for someone that does provide teletherapy, because if they go off somewhere for an intensive or a short program, they're going to be left without the follow-up, versus if they go somewhere that does offer the teletherapy, it's going to really fill that necessary gap. But what do you have to say about that in terms of what would you recommend?
Again, I think a therapist feels safe if they know that there is, for this particular issue, like suppose you have a client and you're working with them on their MPD, or you're working on them on their narcissism, or you're working on them with some issue, a DSM issue, but they do have a sex addiction, which you're not really, that's not your thing. Mm-hmm. And so you would feel safer, okay, go do this intensive, and then they're going to follow up with you on that. But we're going to keep working on your narcissism or your MPD or your other thing, and they can hold you accountable and do that. So we've shared clients all over the globe.
Okay.
That can be a very helpful thing, because we don't go outside. This is our lane.
Right.
Okay. So if you got a client and you're seeing them for depression, we're going to send them back to you for the depression.
Yeah.
Right. But they're going to have more tools in their recovery, and they'll have support system in that. So it's going to actually expedite their recovery with the therapist locally. So that happens.
I like that visual of staying in your lane, because the therapist who works with depression, stay in your lane and tell your client, hey, in terms of your sexual addiction, go talk to your addiction specialist.
Absolutely. Yeah, we have a lot of wonderful female therapists that don't want to treat male sex addicts, and the woman comes in for depression. Well, one of the signs of living with a sex addict or an intimacy anorexic is major depression. We've shown that statistically twice. And so you got a depressed woman whose husband's, maybe he's doing porn, maybe he's cheating, maybe he's whatever. Or maybe he's withholding intimacy, which makes a woman depressed as well, either one. So she goes into her female counselor and says, I'm depressed. And then they find out, well, there's no relationship at home. There's none of this. Okay, great. Now, the wife says, well, why don't you see my husband? And he comes in and he tells her, well, I'm doing porn. I'm doing this. I'm doing that. Well, that female therapist, by and large, does not want to deal with that. It's messy. Yeah. So then they ship them to our lane.
Right.
You know what I'm saying?
That's a perfect fit.
And then she keeps the female client when they go back, but the depression will start lifting better if she's actually being loved at home, or if she feels safe again because her husband, verified that he's been clean for 3 years, but she's been thinking he's not been clean for 3 years.
Yeah. And you have a really specialized knowledge and gift to share the world, right? Your books, your expertise, what you spend your life working on. If you didn't provide telehealth, the reach of that expertise would be much more limited.
Right. I think that the advent of the internet has allowed someone, like I've had 2 clients who've had mold in their house, and they had all kinds of literally physical disease from the mold. Well, there's actually experts on mold.
Right.
Okay. Yeah. And because of the internet, okay, and this is maybe a different realm, but they do consulting over the phone and over the video on the mold stuff. Well, here's what you got to do: get this test, get this, don't go this, do this, and there's actually mold coaches.
Right.
Well, think of such a thing, right? But we have that today, and the same thing. You're right. That sphere of influence would be one city that a mold consultant could actually consult. Well, mold isn't in one city. Mold's all over the country, right?
Yeah. And I know you're training interns. You've trained a lot of clinicians, and it wouldn't work nearly as well if, again, you weren't able to provide services remotely.
Right.
Now
we're doing both.
You're able to train your 15 clinicians on staff and really help people, you know, from all around.
Well, we also train people around the globe. So in the American Association for Sexual Therapy, right now in supervision, I have a guy in Malaysia, a guy in England, a guy in Canada, and several from all over the United States. And so we're doing both. We're training them locally so that there is a local resource, you know, but also we're providing services nationally, internationally for those who don't have one there yet.
Okay.
You know, and so we tell people, if you're seeing a therapist, here's the brochure. Get them trained in partner stuff. Get them trained in, you know, here. Just, you know, tell them about this training. It's not that expensive. And they can, so that person, we've built many six-digit practices, many six-digit practices, because there is a need, and there's very few people who know what they're doing.
Right. Yeah. Let me share your website with everybody. So this is your website. And where would one go to, say, find out about training?
Well, this is the website for sex addiction. They would go to another website, aasat.org. So if you throw that one up,
so it's
aasat.org. There you go, asat.org. On there, you can see there's a sex addiction training, there's a intimacy anorexia training, and all of that. And so we have clinicians all over the world who go through this. And as they go through this training, then they're supervised with me over the phone, okay, for 6 months. And supervision of clinicians is just as fun over the phone as it is in person too, because I have my in-person interns and therapists here, 1 hour, and I'll do that today. But the hour before that hour, I'm talking to people from all over the globe, literally on a conference call, doing supervision on these 3 trainings. So we're doing both. We're raising up a team locally, but we're also raising up a team globally. Right. And so anyone listening to this who wants to get a niche practice and really wants to do some work in this area, it's a no-brainer. I mean, there's so many women who've been betrayed and hurt. Every woman can have a full-time practice. There's so many guys stuck with pornography and infidelity and strip clubs and crazy stuff that you have job security. Like I don't fear ever being out of a job, ever.
Yeah,
right?
I guess the internet has provided access to dangerous stuff, and it also has provided access to help.
Right. No, yeah, there's medicine disease everywhere.
Yeah, that's right. Yeah. Yeah, well, thank you very much. It's been very, very helpful. I know all the listeners are going to be really benefited, you know, from what you've helped us with.
Yeah. Yeah. I encourage them to keep listening to you. You offer a lot of good help, and it's wonderful. So thank you so much.
Excellent. All right. Hopefully we'll talk soon, Doug.
Okay. Take care.
Yeah. Bye-bye for now.
Bye.